So the question, when is home like home? I'm not sure it's answered by environmental design features. It may be more of an emotional issue. And if we go back to Pliny the Elder from 23 to 79 AD, home is where the heart is. Come up to the 1700s, be it ever so humble, there's no place like home. And the 1800s, home is the place where, when you have to go there, they have to take you in. I wonder if that last definition isn't the most closely tied to long-term care. What always goes up and never comes down? What? Taxes. Taxes is probably right. Your age. How do activities and environment interact? Again, no snappy answer. But if we go back to this home-like concept, the second piece, the first piece is home-like. It's supposed to look like the home you came from, because that'll make you more comfortable. But that leaves a pretty wide range and makes you wonder how we're going to find a common ground in that. The second idea of home-like is that a home-like environment is one where residents have the opportunity to participate in activities that are familiar from their past lives as opposed to rigid institutional routines, and in spaces that are similar in scale and form to those found in people's homes. So in other words, we'd like you to be able to do in your long-term care environment what you were doing in your home. So what were you doing in your home? Well, the evidence seems to suggest that since the 1600s, houses continue to grow while families continue to shrink, and home use has become increasingly more private and fragmented over time. And what this suggests is it's a moving target. You design for today, and by the time the 40-year-olds of today get into the long-term care home when they're 80, their expectations are going to be different. Our colleagues of yesteryear who built those hospital-type long-term care homes weren't saying, boy, let's really make a mess of this. They actually thought they were on top of things at the time. What are people doing in their homes, and what do future generations of older people need? What do we need to be prepared for? Well, basically, they're on the internet. They're spending time by themselves, wired. We need to think about that. They are not exercising or being active. The older population is the most inactive segment of the Canadian population. 2/3 don't engage in sufficient levels of physical activity to maintain or improve, this is in the community, maintain or improve their health. Among women, there's a dramatic decline in the percentage that are physically active and moderately active after age 65. And among men, declines in activity start around age 75. And the desire to age in place means that over 1/3 of seniors over 85 are living alone in aging neighborhoods. 15% of them report no close friends and feelings of isolation. So, do we really want to mirror in our long-term care facilities the activity patterns that people were experiencing in the community, or are we actually aiming for an entirely different paradigm? Because it's not going to be hard to mirror what people were doing in the community. Give them computers, no exercise, and lots of isolation. We may have that. We may have already nailed that. Okay. And then gender, of course. There is increasing literature about gender and gender differences in long-term care, and the missing voices in long-term care policy about women and women with disabilities, and gender differences in profiles of nursing home residents with Alzheimer's disease, that again is going to become increasingly important as more and more men live long enough and are part of enough societal changes in terms of family structure to need long-term care. So the question, the conundrum, how do activities and environment interact? I don't know the answer to that, but I do think that it was interesting that the new Chief Public Health Officer's report on the state of public health in Canada that has just come out, that was referenced by a couple speakers earlier, endorses the concept of universal design, encouraging a method that encourages and supports the social interaction and physical activity of all members of society across the life course. And what I thought was interesting about that was he didn't say in his report, encourages the social interaction and physical activity of all members of society except for those in long-term care across the life course. So what can universal design tell us about how we should be designing long-term care homes? Universal design principles are things like equitable use for people with diverse abilities, flexible use that accommodates a range of preferences, simple intuitive use that's easy to understand, perceptible use that communicates information to a range of sensory abilities, minimal hazards and adverse consequences, efficiency and comfort requiring low physical effort, and size and space that's appropriate for a variety of abilities. So sometimes I wonder if maybe what we need to do is be looking at the general literature on universal design as opposed to the specific literature on long-term care. Where can you find roads without cars, forests without trees, and cities without houses? On a map. You guys aren't very good. What would you like to find in your long-term care home? I'm going to challenge you to just think about this. Because some of us, as Ken has so kindly pointed out to us, at least a third of us are probably going to find ourselves in long-term care in the long run. So maybe one of the things we need to do is to set aside the stigma of long-term care and the assumption or the hope that it won't be us, and think about, if I'm going, and I probably will, and I'm likely to have some dementia, and if I know myself, I'm probably going to have some behavioral problems too, what would I like it to look like? Would I like to be in a bigger building complex, like I work in, where you can roam about for all over the place? You can have we have a wandering system that closes the door for people who don't want to go outside, but they're not restricted to a unit. They have four floors and numerous different units, different parts of the hospital. It's not too boring for people. Or would you like a small building complex? Would you like the emphasis to be on personal or small activity group spaces? Or are you more someone who would like the large activity group spaces? Did you like, when you were in university residence, did you spend your time in your dorm room, or did you spend your time in the common spaces? Would you like a private bedroom or a shared bedroom? As you go through this and think about what you would like, I'd suggest that one of the really interesting exercises is to go home and do this with your spouse and find out whether you're actually going to be signing up for the same long-term care home or a different long-term care home. Is your emphasis on indoor activities or outdoor activities? You know, actually lots of people don't go outside very much, and some of us live outside. Do you want to be in a co-ed environment or a same-sex environment? How many people in university residence were in a co-ed, and how many were in a same-sex? Co-ed? Same-sex? Okay. Very different experience is all I'll say about that. Do you want to be in a more urban location or a more rural location? Those of us who live in the country, we want to be in the country. Do you want more home-like amenities or more hotel-like amenities? This is a nice gender split on this one. Do you want the emphasis to be on safety features even if it's more restrictive? Or would you like the emphasis to be on challenges in the environment even if it's more risky? So if it's you, what do you want? So my answer to the question, what would you like to find in your long-term care home, is I don't know that one either, but I really would like us to learn more about what makes communal living acceptable, viable, and enjoyable for older adults, especially those who are frail and those with dementia, and including those with long-standing or newly acquired psychiatric and behavioral symptoms, because the only thing I'm really sure of is that regardless of all of the different types of homes that I've lived in my life, the one constant was that there weren't 20 unrelated people living in the home with me. But that's what it might be, and that's a communal environment. And what is it that works to make communal environments acceptable, viable, and enjoyable for any of us, let alone for people who have the various extra challenges that come with dementia and behavioral problems? So that's what I'd like people to answer in the next 40 years, so that when I am ready to go into a long-term care home, I can choose a communal living environment that suits my needs. Thank you.